Shri Gurubhyo Namaha. A very good morning to all. Guru Brahma, Guru Vishnu, Guru Devo Maheshwaraha, Guru Sakshat Parabrahma, Tasmai Shri Guruve Namaha. With the blessings of my parents, all my teachers, I could gain some knowledge of Ayurveda. And today I'm conveying the same to the students community at national and international level. It's an immense pleasure and honor for me to address all the students of Tadvidya Sambhasha Parishad. It's my sincere gratitude to the organizers of Tadvidya Sambhasha Parishad. I am Dr. Usharani Sanu, Assistant Professor, Department of Sharira Kriya, working in Kahir Shri B.M. Kankanwadi Ayurveda Mahavidyalaya, Belgavi. And today, I would like to put some light on the physiological concept of dosha. Wherever we represent ourselves as Ayurvedic Vaidyas, everybody asks us, oh, doshas. Okay, so wherever there is term Ayurveda, there is the fundamental aspect, that is the dosha. Okay, so it's very, very important for the students of Ayurveda to know what is dosha and how we should know and analyze these doshas in the patients. Usually what we see is in our academic levels when we start our physiology classes, when we start with the concept of cell, the concept of digestive system, the concept of respiratory system, the concept of excretion, okay, our students start digging Gaitan, Hindu Purana and many such books and come up with a lot of doubts. This is this, and why this is not like this, and all these things. But the day we start with the concept of dosha, which is a must and a fundamental aspect of Ayurveda, our students get into confusion. They become in a question mark. And it is really a very confusing status even for the teachers to make them understand, because this is a very imaginary topic. And because of this, aspect of dosha, because they feel doshas are very imaginary and they start losing interest. The main reason for this problem is we come from a Western science background. Okay, why I'm saying this is everybody knows this. We study physics, chemistry, biology as a base up to our pre-university days. Until these days, we don't have exposure to dosha. The term dosha itself is not exposed. So it becomes very tough to digest. Okay. In Ayurveda, the basic fundamentals itself is laid down by Indian philosophical aspects, which are very, very scientific. And so we have to think out of the box to understand Ayurveda. Western science has made us believe to accept what we see, what we experiment, what is observable. In short, what is pratyaksha. Okay? But Ayurveda explains, apart from pratyaksha, other four pramanas like anumana, which is you have to be hypothetical, you have to be imaginary. Okay? Then comes the aptopadesha. Aptopadesha is you have to listen to the experiences of your seers or your forefathers who are experienced in their treatment aspects and have given their knowledge of experience. Then comes the concept of upamana. Okay, what is upamana? What is happening around in the universe? The same thing, the similar thing is happening inside the body. If there is Varsha Rutu outside, if there is Vata Prakopa outside, the Vata Prakopa is happening inside the body also. Hence, we have pain-related diseases seen more in Varsha Rutu. So, such type of similarities, okay, nature to human similarities. Then comes the very, very important pramana, that is yukti, which is the logical understanding by the intelligence of a person. This pramana is very, very important because there are so many texts saying so many things, but it is only your logic which is going to help you in understanding the concept and further application of these concepts. So, dear friends, without understanding this basic thing, we cannot move ahead. Okay. Then, using all these pramanas, you have to enter into the concept of doshas. Okay. So, whenever we start with the concept of dosha, we cannot forget the concept of Pancha Siddhanta. Okay. Because Sarvadravyam Panchabhautikam. Okay? All the dravyas in this universe are made up of Panchamahabhutas. It may be your Prithvi, Apa, Agni, Vayu, Akasha. These are the fundamental factors present in all the elements of the universe. Similarly, these factors are the fundamentals of doshas also. So, if you know the concept of Panchamahabhutas, you will understand the concept of doshas also better. The base of Ayurveda is laid by various philosophies. And one such philosophy is Vaisheshika Darshana, which says about atomic level of elements. Okay? Atomic level means the Tanmatra level of the Panchamahabhutas. At Tanmatra level, these Panchamahabhutas are invisible. When there is cross combination of all these Tanmatras at an elementary form, these become visible to the human eye. Here comes the concept of Vata, where the Tanmatras are not visible. Whereas in Pitta Kapha, this become visible. Okay? Yes? So, when we speak about doshas, there are basic classification, namely Sharirika dosha and Manasika dosha. Okay? Now, my main objective of this class is to understand the concept of dosha, to know the classification of dosha, then to understand the attributes, that is the guna of doshas, and why it is necessary at clinical level, to know the sthana of dosha, to know the types of subtypes of dosha, then the functions of dosha, at last the vriddhi and kshaya of doshas along with some clinical aspects. Okay, so coming to the dosha definition, dushyanti iti dosha. Okay, dushyanti iti dosha means the regulatory factors of body and mind which have the capacity to govern or to vitiate other substrates or other dushas like dhatu, mala, upadhatu, and so on. Okay, these have a special capacity to hold and control the doshas. When we classify, there are two types: Sharirika dosha, Manasika dosha, as I told earlier. Sharirika doshas are Vata, Pitta, and Kapha. Manasika doshas are Rajas and Tamas. Okay, so when you go for entrance, you usually get confused when this question comes. Number of Manasika dosha. Okay, it is Rajas and Tamas. There are two Manasika doshas, whereas when there is Sattva, it is called as Triguna. Okay, it is Mahaguna of Manas and cannot be considered, Sattva cannot be considered as dosha. Okay, yes. So, when we start with Sharirika dosha, that is Vata, Pitta, and Kapha, we see the term Vata, which is invisible. As I told you, the atoms of Vata are invisible. But how can we know that there is Vata dosha? Avyaktaha vyaktakarmaha means though we can't see, but we can feel its actions. We can see the actions, but not the Vata dosha. Okay? See it through its actions. Vyakta karmaha. Yes? This dosha is predominantly made up of Vayu and Akasha Mahabhuta. And what is its functioning? The functioning of this dosha is movement. Various types of movement inside the body. It may be right from the movement of your eyelids, right from your speech, right from your inspiration or expiration, peristalsis, your closure and opening of heart valves, your excretion, okay? Everything, all the movements are covered inside the functionings of Vata dosha. Then comes the Pitta dosha. The Pitta dosha is made up of the Pancha Bhuta named as Agni, which is very, very fiery element. Okay? And this is representing in the form of digestion, metabolism, your thermal regulation of the body, okay? Your various secretions, digestive enzymes, your chemical reactions in the eyes, your thinking capacity or thinking chemical reactions, all these things come under the functions of Pitta. Then comes the function of Kapha. Kapha is an element which is responsible for keeping the compactness of the body, cell to cell contact, tissues compactness, organ compactness, okay? And later anabolism, nourishment of all these structures. Along with that, there is lubrication of organs, lubrication of your skin, lubrication at your level of sclera, conjunctiva, lubrication at your nasal region, oral region. All these are the main functions of kapha. Okay, so knowing these things at an introductory level, we will like to enter to know the basic concepts of doshas. We would like to enter into Vata dosha. What is Vata dosha? Va gati gandhanayoho. Va gati gandhanayoho means what? The one which is responsible for the Va means gati and gandhana means enthusiasm. Okay? Gati, as I told you, movement at every step. It may be your adduction, abduction, circulation, transport, all these things. And enthusiasm at the level of your mind, okay, the one which keeps your mind very active, the mind which is working very actively with your thoughts. All this enthusiasm is the main functions of Vata. How is this Vata functioning in your body? It is functioning with the help of its basic attributes, that is gunas. So what are the gunas of Vata? Tatra, Ruksha, Laghu, Shita, Kara, Sukshmas, Chalo, Anilaha. Yes. So this also becomes a CET point of view, where they can either ask what are the number of attributes of Vata, and either the question can be whether Khara is the attribute of Vata. So each and every term here can be a CET question, because here Shita and Shita Guna, okay, Shita Ruksha is the quality of Vata, whereas Shita Sneha is the quality of Kapha. So such type of questions is also expected from the entrance point of view. Okay. Then coming to the next point, that is Sthana of Vata. Okay, where is this Vata situated in the body? Vata is situated in Pakvashaya Katisakti, Srotrasti Sparshanendriyam, Sthanam Vatasya Tatrapi Pakvadanam Visheshataha. Okay, though every cell at every Paramanu level the Vata is working, but the main sthanas where the Vata is present is Pakvashaya, your large intestines, Kati, your lumbar region, Sakti, your thigh region, okay, Srotrasti, your ear bones, then Sparshanendriyam at the skin level, that is organ of touch. But even though all these are the sthana of Vata, where the main functionings of Vata are seen, okay, first these are the sites where the main functionings of Vata are seen, but the main sthana of Vata is Pakvashaya. Why Pakvashaya? Because the nourishment of Vata, nourishment and utpatti of Prakrita Vata happens in Pakvashaya. We can see in Avastapaka how in Katu Avastapaka the Vata utpatti takes place from your ahara. So this Vata which gets origin in your Pakvashaya, okay, nourishes the overall Vata of your body. Okay. So Pakvadhanam Visheshataha. So Pakvashaya is the main sthana of Vata, is also an entrance question, okay, which is the main sthana of Vata. Then subtypes of Vata. The subtypes of Vata are 5. Okay, what is that? It is Prana, Udana, Vyana, Samana and Apana. Okay, even this can be an entrance question, but it is a very simple question, basic question known by everyone. Okay, Sthana of Pranavata. Okay, so Pranavata is present in your Murdha Oragaha, Kanta, Jivha, Nasika, Shacharaha. Okay, the Pranavata is situated in Murdha, that is the head region, Uraha, chest region, and it moves from head region up to the chest region and up to Nabhi. Ashtanga Hridaya says, Uraha Kantascharo, Buddhi Hridayendriya Chittadrak, Shtivanam Shvetu Udkara, Nishwasa Anna Praveshakrat. Means what? This Pranavata is responsible for the Anna Pravesha, that is deglutination, okay, Nishwasa here means inspiration, okay, Buddhi, that is the thinking, analyzing capacity, Indriya is grasping the objects, So all these are the main functionings of pranavata. This can be compared to the parasympathetic system or the cranial nerves, okay, which are involved in the basic functioning of the sensory organs along with deglutination, okay. This can be compared with the functions of even the vagus nerve, okay. Then comes what happens if there is any vitiation to the pranavata. Vata gets affected, the person is really suffering from hiccup. Hiccup is hiccups, uncontrollable hiccups. You cannot control. It is involuntary. Okay. And udgara, belchings, uncontrollable belchings. Even shwasa, it is very deep inspiration. Okay. All this can be compared to the malfunctioning of pranavata. That is, cranial nerve disorders can be taken under pranavata functioning. Okay. Then comes the concept of udanavata. Udanavata is sthanam uraha. Uraha sthanam udanasya. Vak pravritti prayatna urja balavarna smritikriyaha. Bhasha gitadi shabda uchvasadi visheshataha. Means what? These are the functions related to your thoracic plexus. This vata is responsible for this uchvasa, expiration. Okay. See, pranavata is nishvasa, that is inspiration, whereas udanavata is expiration, that is throwing out of air. Okay. So, vak pravritti, speech production. Okay. Production of speech, then production again efforts. Efforts is the motor efforts of the body. Urja is again the body temperature, depends upon the udana vata. Then bala, strength of the body, varna, and smriti kriya. Smriti is also the functions of vata. Many times it is a confusion during the entrance, but very, very important point, smriti, bala and prayatna, all these are the functions of udana vata, which usually becomes a confusion during the time of entrance exams. Okay. Then bhasha gita, when if you have to speak, if I am speaking to you with the efforts of udana vata. Gita, if somebody has to sing, okay, there is the functioning of udana vata by the functioning of the vocal cords. Okay. So these are the main functioning of udana vata. Now what happens if udana vata gets malfunctioned? If there is malfunctioning of udana vata, there are diseases like shwasa, okay, expiration problems, okay. Then there are even tremors seen, tremors, like because prayatna, all the motor activities depends upon the functions of udana vata, even excessive tremors, okay. These are the malfunctionings of udana vata. Then comes the Vyanavata, Krishna Deha Chari, Rasa Samvahanoditaha, Sweda Asrak Sravanaschapi, Panchada Cheshtatityapi. This means the Vyanavata, which has taken its ashraya in Hridaya, okay? Main ashraya is in Hridaya, but it is circulating throughout the body. Krishna Deha Chari, it is moving throughout the body and it is responsible for all the circulation of dhatus, okay, now taking the nutrients to each and every dhatu. Vikshepa, it sees whether the nutrients has reached, whether the dhatu paka is going on, okay, whether the dhatu conversion is going on, the parinama is going on or no, okay. And then responsible for all the pancha cheshta like utshepa, apakshepa, nimesha, unmesha, okay, your body movements, abduction, adduction, okay. All these is the functioning of Vyana Vata. Now this is the main Vata for your walking, for your activities of your hand, okay, for activities of your eyelid, everything is controlled by Vyana Vata. And if there is any malfunctioning of Vyanavata, then there is lack of movement. Lack of movement occurs. For example, if the Vyanavata functioning is stopped at the hand, okay, then the person cannot lift his hand. If Vyanavata malfunctioning happens at the legs, then the malfunctioning happens at the legs. That is, he cannot lift the legs. Okay, this we have seen in case of paralysis, where Vyanavata functioning becomes hampered. This can be seen when in polio, where Vyanavata functioning gets hampered. Okay. Then comes the next vata, that is Apanavata. Apano Apanagaha. Shroni Basti Medra Urugocharaha. Shukra Artava Shakranmutro Garbha Nishkramana Kriyaha. This means the vata which is present at the pelvic level. Okay, the vata which is present at the pelvic level, and it is responsible for the control of the pelvic plexus functionings. For example, it may be your excretion of urine, okay, urination, excretion of urine. It may be defecatory activities. It may be rejection of semen. It may be the controlling of your menstrual cycles and menstrual cycle, shedding of endometrium. All these things are under the control of Apanavata. And further, at labor, the production of labor pain, and then the expulsion of fetus is also, okay, the delivery of fetus is also the function of Apanavata, which is very, very important. If your Apanavata is functioning normally, then all other Vatas will be functioning normally. So this is also a basic concept of Vata. Okay. Now, coming to the malfunctioning of Apanavata. What happens if there is malfunctioning of Apanavata? Apanavata malfunctioning usually causes mutra krichra, okay, difficulty in urination. One cannot go for urination, or if he goes also, there will be dribbling of urine, and there will be mutra krichra, severe pain during urination. And sometimes if there is mutra vriddhi, there can be excessive urination. Frequent urination is always seen. So this is also apana dushti. At the rectal level, the apana vata can cause even constipation. Constipation, severe constipation due to vata prakopa. Okay. Severe abdominal distension. All these can be seen in case of apana vata malfunctioning. Okay, so these are some concepts of the subtypes of vata. And one thing what I've missed is samana vata. Samana vata, which is near to the agni. Okay, samano agni samipastha. Okay, so what is the main function of this samana vata? Okay, this is annam ghrannati pachati vivechayati hi kriyaha. Means what? The anna which is taken is mixed with the enzymes and the digestive juices, and sarakitta vibhajana is done. Whichever is the essential part is taken, and whichever is not required is separated out. Okay, and then the separated out is pushed ahead for elimination from the body, and whatever is absorbed is tried to be assimilated in the small intestine. It is pushing for the absorption from the small intestine. So this is the function of samana vata, which can be correlated to the functions of the colic plexus. Okay, if samana vata functioning gets disturbed, first is the normal peristalsis gets disturbed, then your absorption gets disturbed. Okay, there is always colicky pain in the abdomen. There is malabsorption syndrome developed if your samana vata gets disturbed in the body. Okay, so till now we have discussed about the subtypes, their sthanas, where they are acting, and we have also discussed how these vata become important. Yes. Now comes the concept of overall vata vriddhi and vata kshaya. What is vata vriddhi and vata kshaya? As I told you, friends, in the initial point itself, the attributes, that is a guna of vata, is very, very important. Okay, because these gunas are nourished at various levels, and these cause the vriddhi of vata or kshaya of vata. Your ahara, the food you intake; vihara, your activities, your daily activities; your manasika vichara, okay, your manasika vichara, and others like desha, kala, rutu, okay. All these are the factors which affect the vata dosha, because it affects the vata gunas. Now, if the ruksha quality of vata increases, okay, it leads to vata vriddhi. When does your ruksha quality increase? The ruksha quality increase when you take rukshakara ahara vihara. Okay, you have junk food which is uh, very dry, okay, which is preserved for a long time. Okay, so such dry junk food can produce rukshata in your body, and this rukshata can cause vata vriddhi, and this vata vriddhi further at apana level can cause constipation, at samana level cause indigestion, at udana level cause breathing problems. So these are the applied aspects. Okay, so what happens when there is vata vriddhi? When there is vata vriddhi, there is kashya kashna ushna kamitva kampa anaha shakrit grahan. Okay, what is kashya? The person's normal coloration is affected. He becomes bit dull or blackish in coloration. Kashna, emaciated. He becomes very lean. Okay, the person seems to be very lean. Ushna kamitva, there is always desire for hot food. Okay, you can see people suffering from fever, okay, or general weakness. They always have a affinity for hot water or hot food. After consuming hot food, they feel a bit energetic, or they feel a bit comfortable, okay, and they feel they have a little bit of energy to do work. This is because the vata vriddhi which has taken place has calmed down, okay, and this has given bala in the form of agni vriddhi, and then there is kapha production, and this gives bala to the body, especially in case of jwara, okay, especially in case of pandu. We can see all these conditions where ushna kamitva is also increased. Okay, then coming to next one, that is vata kshaya. Vata kshaya is lingam shine anilasye sado alpa bhashite hitam. Okay, lingam shine anilasye anga sado alpa bhashite hitam means what? Whenever there is vata function reduced. Why vata functions get reduced inside the body? Whenever there is any block or avarana by your ama, indigested products, if go and get blocked into some channels, okay, there can be either vata vriddhi or vata kshaya depending upon the condition. Okay, so the vata kshaya does angasada, reduces the energy of that particular site. Okay, and then there is alpa bhashite. Alpa bhashite means the person doesn't have energy even to speak, or he speaks very less with lot of debility in his body. So this is something which happens in vata kshaya. There is normal conduction of vata at that particular site. Then the treatment aspect. What is the general line of treatment in vata? As you all know, When we speak about the treatment aspect, there are treatments like preventive and curative. Okay. In preventive aspects, you have to follow the dinacharya. Okay, Brahmi Murta Uttishte. Then see whether the food is jirna or no. And then there should be mala nishkramana. Okay, at proper time, if your mala is evacuated out, then your vata is always active inside the body, and this vata nourishes all the other vatas, and that keeps up your enthusiasm. And then further you can control your vata with abhyanga, snana, nasya, dantadhavana. All these measures, whatever are explained in dinacharya, is for the control of vata, agni, and all the other doshas. Then you have to follow the Rutucharya also. Okay. Rutucharya, like the Ahara Vihara for that particular Rutu, the activities for that particular Ritu. Okay. Avoiding Divaswapna, avoiding Guru Ahara Vihara. Okay. All this becomes very, very important. Fine. Now, the concept is, how should we go or how should we plan the treatment? Okay. Shamana Chikitsa and Shodhana Chikitsa. For every Vata disorder, we do not go for Shodhana Chikitsa. There are Shamana Chikitsas also involved. Okay. What is Shamana Chikitsa? Shamana is simple, your Sneha, okay, your Taila, simple coconut oil, Grita, your pure ghee, okay, along with your food, can also be a Shamana Chikitsa. Snigdha Ahara Vihara to control Vata can also be a Shamana Chikitsa. Okay. But if there is ama involved, if there is ama or indigestion involved, okay, direct treatment to the Vata will not be successful. It's very, very, very important that you do ama pachana first and then Vata. When there is ama pachana, your srotas, your channels are open. Okay, and then whatever medicines you give are absorbable, and that can reduce your vata. Okay, now there are so many medicines available in the form of gritas, in the form of tailas like Gandharahastadi taila, then Karpasa taila, and many tailas are there which are vata hara in nature. There are various combination of yamaka, various combinations of medicines like Hingvashtaka Churna at a Churna level, which can control Vata. Okay. This is at the Shamana Chikitsa level. Then comes at the Chikitsa of Shodhana. Okay. Whenever the Vyadhi is deep rooted, you have to plan for Shodhana Chikitsa. For example, there is frozen shoulder, there is paralysis, there is motor problems. Okay, all these are motor problems. Nidra, Nasha, even this is the pathophysiology of Vata. You have to plan for Shodhana treatments. Again, when you think about Shodhana, there is Bhaya Shodhana and Abhyantara Shodhana. In Bhaya Shodhana, the beautiful treatments like Abhyanga, Swedana are very, very, very effective in case of Vata disorders. These are the treatments which we see in day-to-day practice. Proper Abhyanga with a proper medicated oil can improve your circulation of Vyana Vata. And followed by Swedana, depending upon what Vyadhi it is, because Swedana again can be Snigdha Sweda, it can be Ruksha Sweda, okay. If there is lot of ama, there should be requirement of Ruksha Sweda, like the Swedana with Valuka Sweda, okay. All these Swedanas are adapted to reduce Vata in the body. Along with that, there are various other treatments explained like Shirapichu, Karnapurana, Netra Tarpana, Gandusha with a hot oil, Okay, warm oil, not very hot oil, warm oil. Okay, then padabhyanga. Okay, all these are the measures for your protection and good functioning of your nervous system. Okay, which is always active. Then comes the Abhyantara Shodhana. Whenever we speak about the Abhyantara Shodhana, Charaka highlights in case of Vata, you have to do Basti as Chikitsa. Okay? Basti is a prime treatment in case of Vata dosha. Basti again is of two types, Niruha Basti and Vasana Basti. And then there are many more types like Matra Basti, Matra Basti, Yapana Basti. Okay, depending upon what is the pathology, how deep rooted is the pathology, what are the dhatus and doshas involved in the pathology, you have to plan the Basti as a procedure, which can be very, very effective. Okay, I think with this brief note on Vata dosha, I'll just summarize. We have just seen the definition of dosha, dushyanti iti doshaha. I have already highlighted that whatever you see is not only the concept, you have to be beyond the box, you have to think beyond the box, and you have to start feeling, you have to feel within yourselves what is the function of these doshas in your body, to understand these doshas in yourself, and then you can analyze the doshas in others. Okay, so these doshas are defined in a standard terminology as regulating factors of body and mind, which can control your other substrates like dhatus, malas, and upadhatus, which are called as doshas. Okay, so these doshas are having their fundamentals in Pancha Mahabhuta. The Pancha Mahabhutas at Tanmatra levels at different combination form different doshas. Okay, the Vata dosha is made up of Vayu and Akash. Pitta dosha is made up of Agni. Kapha dosha is made up of Prithvi and Apa. Okay. Then when we come to the this classification of doshas, there is Sharirika dosha and then comes the Manasika dosha. Sharirika dosha is the doshas which are operating at the physical level, like Vata, Pitta, Kapha. Manasika doshas are the doshas which are operating at the mental level, that is Rajas and Tamas. Vata dosha, if you see, this is the dosha which is responsible for the various movements, transportation, circulation in your body. Pitta dosha is for the metabolism, thermoregulation of your body and chemical reactions. Kapha dosha is for your anabolism, okay, lubrication of your body and maintaining the compactness of your body. And then coming to the attributes of dosha, especially we entered only into Vata dosha today. Okay, so Vata dosha is Tatra, Ruksha, Lagu, Shita, Kara, Sukshma, Chalo, Anilaha. Every attribute is very, very important because every attribute is having its own clinical importance. It's Ruksha Guna, which can cause fibrosis. It's Lagu Guna, which can cause demyelination. It can then there is Khara Guna, which can cause again fibrosis. Then there is Ati Chala Guna, which can increase the movement of the body parts like tremors and all. Okay, so every attribute has its own clinical importance. Then we have also seen the sthana of Vata, where we have seen Pakvashaya as the main sthana, because Pakvashaya is involved in the nourishment of Vata, because there is a Majjadhara Kala which is nourishing Vata to the this nervous level. Okay, the Vata which is produced at the Pakvashaya level further nourishes the Majjadhara Kala and then nourishes the nervous system. Then we have seen the subclassification of Vata, that is Parna Vata, Udana Vata, Samana Vata, Vyana Vata, Apana Vata. Then we have seen how prana is situated at the level of head and it is circulating from head up to your umbilical region and having your parasympathetic control because these functions are involuntary. Okay, and how it is responsible for your buddhi, indriya, hridaya functions and anna pravesha, nishvasa, inspiration. And I have highlighted even the entrance questions in this. And then we have seen the other plexus, that is your thoracic plexus, that comes under the Udana Vata, which is responsible for your Uchshwasa, which is responsible for the Bala, Varna, Prayatna, okay, and mainly responsible for again Smriti Kriyaha, which again is a entrance point of view, as I told you. Yes. So what happens whenever there is problem with Udana Vata? There is usually breathing problems, motor activities are reduced, Bala is reduced, Utsaha is reduced. So all these abnormalities can be seen in Udana Vata. In Samana Vata, Samano Koshta Samipastaha. Okay. So this is the Vata which is responsible for the normal digestion. Okay. It is responsible for the Sarakitta Vibhajana and later absorption of all the essential molecules and elimination of the toxins outside the body. Then there is Apana Vata, responsible for the excretory activities, excretion of Mutra, Mala, then Shukra, Artava and also the Garbha. And abnormality, as you know, Apana Vata abnormality causes constipation, lot of urinary problems. It can cause obstructed labor. It can either cause seminal problems and lot of problems what we see in our day-to-day patients. Okay, this is because of stress what we see, and Apana Vata gets hampered. Then there is Vyana Vata, which is again responsible for the activities of the body. Yes, for all the 5 types of activities like adaptation, adduction, then your movement of eyelids, your movement of this heart valves, everything, the whole circulatory aspect is under the control of Vyana Vata. Okay. And then after seeing the subtypes, we have also seen the overall Vriddhi and Kshaya of Vata, where in Vata Vriddhi we have seen Kasha Kashushna Kamitva Kampa Anaha Shakrit Grahan. It starts with Shakrit Graha. Whenever there is Vata Vriddhi, it starts, the main starts with Shakrit Graha, there is constipation, and then further there is Anaha, Admana, and further it reaches to what? Ushna Kamitva. The disease further increases with Ushna Kamitva, and there is Kasha Kashna. The person becomes very lean, the person doesn't have appetite, the person becomes very ill with loss of complexion and all these things what we see in Vata Vriddhi. Okay, you can imagine a very emaciated patient with no much bala for work in case of Vata Vriddhi. Then Vatakshaya in Linga Shini and Ilasya Angasya Sada Alpabhashitam, that is, there is emaciation of the muscles, and there is no power in the muscles, no muscle tone. Okay, and then there has no energy even to speak. So such symptoms can be seen in case of Vatakshaya. Then the treatment aspect, I've already said there are preventive aspects, there are curative aspects. In preventive aspects, you have to follow Dinacharya, Rutucharya, okay, and very important is Na Vegandharya Adhyaya, okay, where our Acharyas have highlighted if your Vegas are suppressed, then the first thing which is going to affect is Vata, because it causes reverse peristalsis, which leads to Vata Vriddhi in the body and leads to many diseases. Okay, so all these things are for the prevention of Vata diseases. Then comes the curative measures, where there are various Shamana procedures explained, like Amapachana and then Snehana, Svedana can be given. And then Panchakarma procedures for the deep-rooted vyadis, where Basti is the first line of treatment, okay, followed by other treatments, can also be given in Vata vyadis. Okay, with this lecture, I thank the organizers once more for giving me this opportunity, and thank you.